treadmill for some cardiovascular. Have you used the treadmill before? Yep. Okay, so on this one here, we've just got the automatic stop button. Stop button, so if you feel like you're about to fall off or you just feel uncomfortable, that will automatically shut off the machine. We've just got a quick start here. So you just press that and it'll automatically go to the slowest, and then all your speed levels and inclines over here. So all I want you to do is just walk for a minute. So we'll just put that on 4 for you. We'll just do a quick warm up. Warm up. So your maximum heart rate would be around about 190. So when you're in the middle of your exercise routine, we want you to kind of be working towards the 70 to 80% maximum heart rate to really make sure that you're getting the most out of your workout. Did you like doing running? Not really. Not really. Nice relaxed shoulders. Alright, so we'll just move you up to 8. Just do a light jog. See, keeping your shoulders nice and relaxed. So you haven't run much? Do you go to a gym? Occasionally. Is it something you want to be able to do?
Yeah, I'd really like to be able to run more.
So we'll just lower it back down to 4. Place your hands on the side, stop, and then jump off. Here we've got the spin bike or cycle. This is just another form of cardio that you can do with varying resistance. Yeah, okay, let's start again. So here we've got the cycle. This is just another form of cardio that you can do. There's various forms of resistance. There's also programs on here for you to do endurance and then high interval training. So just for the first point, we'll just make sure that the seat is at a comfortable height and your feet are locked into the straps. Yep, all good. Okay, so we'll just pop your hands on here. Yeah, and we'll just start. Just do a quick start. Okay, is that on easy or hard?
That's pretty easy there.
That's on easy? Okay, so we'll just do that for about 30 seconds. So how does that feel? That feels alright and comfortable?
Yeah.
Yep. The bike form of cardio you like to do?
I think it would be a lot easier on my knees than running would be.
Yeah. So you've got some knees?
Yeah.
Alright, so we're just going to change the resistance and make it a bit harder for you. You can even make it as hard as you want to where you have to stand to literally push them off. So good exercise is to increase and decrease at 30-second intervals. Just really gets the heart going. And back down again. Just do it about 30 seconds on easy. pop off. So for our next exercise, we're just going to do some innovative cardio. So that's just that high intensity interval training. So for the first one, we're going to do 10 star jumps followed by 20 seconds of mountain climbs. Have you done them before? Okay. So the 10 star jumps, you just put your hands by the side and then bring them up when you jump and come back down. So just do that 10 times. Yep. And the mountain climbs, we just go into the bridge position, bringing our knees up to our chest and engaging your core. Like that. So we'll just do that for 20 seconds. Yep. And then we'll have a 20-second break. Do it all over again. Cool. I'll stand up here. So then I'll come in this way. Yeah. Alright. I'll just edit this bit out.
Yeah. So just one more? 10.
Yeah, 10 star jumps. Yeah. Your core. 10 seconds to go. 5, 4, 3, 2, 1, and stop. Brilliant. Good. So, is that tiring?
Yeah, but it feels good.
So I'm just going to do the special populations part of the assessment. The first thing I'm going to talk about is high blood pressure. People with hypertension can really benefit from exercise, even if it's just 30 minutes a day at a moderate level. The things we need to concentrate on with people with high blood pressure is medications. There are medications such as beta blockers, which impair the body and irregulate temperature, and also another type of medication would be an alpha blocker, which may cause the blood pressure to lower too much if the exercises is ended too abruptly. In this case, we would need to extend the cooling off period and make sure their heart rate is brought back down to a low, safe rate. Other considerations as a PT we would take is to avoid exercises where the feet and arms raise above your head. A good example of an exercise for a client with high blood pressure is a wall push-up. Now I'm just going to talk about lower back pain. As a PT, we would need to concentrate on doing exercises that do not require the client to put a lot of strain on their lower back, and or exercise that really twist and make the spine go out of place. The client will need to really engage their core, as this will help brace them and their back. A body weight exercise like a wall squat would be ideal for someone with lower back pain. Lower back pain is caused by many various things. It can be from someone who simply just hurt themselves during a sporting injury and they just need a little bit of rehab, it's a little bit sore, so we just need to be considerate of that at that time. Another thing is lower back pain is caused by someone being obese. So we just need to work that into their routine to get the best results we can for them. The next one I'm going to talk about is a knee injury. With a knee injury, we wouldn't want the client to do any high impact sport like running on a treadmill, jumping vigorously, things like that. So body weighted exercise would be a great starting point for this. An example of a great knee injury exercise is a VMO hold, or also incorporating hip movement exercises. This will help bring everything back into place and making sure they're not relying on the other knee too much, which will cause could cause the other knee to be strained also, because we really need to just concentrate on strengthening that knee. All special populations really need to get a professional medical practitioner to sign off on any exercises. This is just so we can make sure we're really benefiting the client and we're not doing anything too strenuous. So now we've done all our exercises, we're just going to do a quick quad stretch. So what I want you to do is just bring your feet together, bring your hips forward, bringing your heel to your bum, keeping your knees nice and close together. Holding that for 10 seconds. You can use the wall if you feel unbalanced. Just hold it for 10. Alright, and we'll swap legs and do it to the other side. Stretch out our pecs. So what I want you to do is you put your forearm at 90 degrees, bringing your front foot forward, pushing forward, and then just looking the other way and holding that for 10 to 30 seconds just to really feel the stretch in there. So push as much as you can until you can feel the stretch. And then we're just going to swap sides. Okay, so just do that one. Yep, bringing, yep. Can you feel that stretch through?
Yeah.
Yep. Does it feel good?
Yeah, it does.
Okay, so we're just going to do the opposite side. And again for 10 to 30 seconds. Okay, good, that's 10 seconds. If you feel like you've had a good enough stretch, then that's all done.
Awesome.